Welcome, everybody. It's the Radio Surgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Thank you, Rob. I'm here with John Toronsky. Good morning, everybody. I hope you're up bright and early on this Saturday morning.
Good morning, Doc. How's it going today?
John's my co-host. Good morning. Great to see you, as always.
Yes.
Mike and Coop are running the controls, so they're giving the thumbs up.
The A-Squad's here.
They're making this show happen. Mike is answering all the calls. We're live in New York City, so unlike pre-recorded stuff, we are sitting here live in the heart of New York City. We're just a few blocks from our office. Our office is at 38th and Broadway, and the goal of this show is to try to bring you information that's truthful, honest, scientific, without selling cockamamie oil. And
a lot of that's out there, Doc.
Well, I know it's out there, and for people who spend a lot of money, actually, there's an industry out there buying cockamamie oils and stuff, and it's about $35 billion. And there's not much data out for it, and we're just warning people, not to spend your money uselessly. I'm just, for an example, I got an angry call from someone who believes in vitamins, which is great to believe in something, but like Ronald Reagan used to say, trust but verify.
Right.
We want to verify. If you've taken things, if you have a cancer and you think your vitamins are helping you, well, let's just look at a study. There was a study in Finland at the National Cancer Institute that looked at 29,000 men, all long-term smokers, more than 50 years of age, so they were at very high risk for cancer and heart disease, and they were given vitamins, vitamin E, beta-carotene, both or neither. And the whole idea was to look at, do vitamins, do antioxidants help people? And the results were clear. The results showed that people taking both supplements and vitamins were more likely to die from cancer and heart disease than those who didn't take anything.
I know we had this conversation a few weeks ago, Doctor, regarding antioxidants and certain vitamins.
Right.
And, this is certainly news to me. I'm sure it's news to many people who are listening.
But there were many people who were angry, say, how can you say that?
Right.
Well, there's data, and I can give you references. There's a great book with all the references. It's called Do You Believe in Magic by Dr. Paul Offit, O-F-F-I-T, M.D. He was on our show on WOR last week, and it's on our website if you want to listen to 1 hour of myself with Dr. Offit. Great show, a lot of information, and I'm happy to provide references. So it's not just saying something, but there's proof out there with tens of thousands of people. So please, before you spend your money on something, please look at the data. You don't want to be taking something that's going to increase your likelihood of dying.
Now, Doc, I'm going to check that out. What's the website? What's your website?
On WOR or my own?
On your own.
Well, they're both. Mine is rsny.org. So listen to it. Listen to the interview with Dr. Paul Offit. And I've had people come in for consultations. I'm not asking you to come in. I'm not trying to sell anything. I'm just trying to help do the right thing for each person. I'm trying to be the brother's keeper. This week, in Jewish life, there's a different Bible story that's read every week. It's divided up into all the weeks of the year. And last week was the story of Cain and Abel. And as you remember, Cain killed Abel. Right?
Yep.
And his father said, where's Abel? And, Abel wasn't there. And Cain said, am I my brother's keeper?
Right.
Right. So he didn't say exactly that he killed his brother, but he killed his brother.
Yeah.
And he killed his brother to get the inheritance of Abel.
Right.
And so are we our brother's keeper? So in that light, and without actually knowing that, last week I was at the National Cancer Meetings in Atlanta. It's the largest radiation cancer meetings in the world. There were almost 10,000 people there. There were 4,000 doctors there. And there were these buses that were taking people back and forth from their hotel to the convention center to hear the lectures and to learn the latest facts, which we're going to talk about in the show today. And my son and I got on the last bus on the last day.
Okay.
Okay, now these buses go around, And there's about 2 trips every hour, so you can imagine that the drivers take about 50 people, mainly doctors, from the convention center to the hotel or from the hotel to the convention center. It just goes around and around.
Sure.
So 50 on a trip, 2 trips an hour, let's say. It's probably even more. That's 100 doctors times 8 hours. It's 800 times 5 days. It's 4,000 visits, right?
Right.
So we got on the last bus on the last day.
Okay.
Okay?
Just made it.
We just made it. We got up. They walk up the stairs. The driver, it's a bus where the driver sits kind of low down, and you walk up the steps so you can kind of look down on the driver.
Right, exactly.
Have you ever been on a bus like that? It's a fancy bus.
Yeah.
Like a cruiser.
Yeah.
And I look down, and there's a cancer on the scalp of the driver.
Get out of here, really?
And I look closely, and it looks like a squamous cell cancer on the scalp. He shaved all his hair. He's probably losing his hair. He shaved all his hair. And I sat down with my son. I said, he's got a squamous cancer. My son, who's a medical student, went and looked. He said, yeah, what are you going to do? I said, well, I think we should tell him. My son says, yeah, you have to tell him.
Yeah, of course, yeah.
So you say, of course. Okay, so remember, this bus driver had seen 4,000 doctors in the last 5 days.
Right.
Okay? So probably everyone told him, right?
Yeah.
Wouldn't you think so?
I mean, I would think so. Yeah.
Okay. So we're leaving the bus, and we stop, coming down the steps, and I pat him on the shoulder. I say, thanks for the ride. And, I said, you've got what looks like a squamous cancer of the scalp. He said, no, that's not a cancer. It's just whenever I shave my head, I always cut myself on that bump recently.
Yeah.
And I said, no, you're not cutting yourself on the scalp because there's nothing there. You're cutting yourself because there's a cancer there. The cancer is growing into a big enough bump now that now you're hitting it every time you shave, and it's causing you to bleed and
like
causing
a speed bump.
pain.
He's catching,
Right, like a speed bump.
Yeah.
I said, please, mister, please, go to your doctor, get it checked out, go to dermatologist. You need a biopsy. You need that treated.
Right.
Because if you don't do it, it can kill you. And we got off the bus, and that was a week ago. And my son said, remember to tell people on the show about this story.
Yeah.
That one doctor out of 4,000 told this man what to do. And, well, first of all, one doctor observed it and told the man. Maybe other people observed it but didn't say anything, or maybe they didn't observe it. But, it's like, should we be our brother's keeper? I think we'd probably have a better society if we were our brother's keeper and help the next guy rather than to ignore the next guy.
I think I'd rather know than not know. Even though the news might not be the best news.
Well, wouldn't you rather know it today when it's curable than 10 years or 10 months or 10 weeks when it's not curable?
Sure.
So it's interesting, and I guess I was thinking about what's the moral of the story. Well, it could be you should be your brother's keeper. Mm-hmm. Should be, well, do you want the doctor who's going to try to go the extra step to help you out when he doesn't have to, right? And the guy could have told me to go to XYZ.
Yeah, sure.
But my son and I thought it's the best thing to do, it's a moral thing to do, and it's brother's keeper.
Yeah.
So that tells you a little bit about who I am. Again, this is Dr. Lederman from Radio Surgery New York. We have this program on ABC Radio every week. We're live. We're happy to take your questions. Our phone number is 1-800-848-9222. 800-848-9222. And we have a booklet and a DVD that we're happy to send to you for free. If you call the number, you can just speak to Mike, and he will either get your address and send it to you, or we'll put you on the show and have your question. Or if you want privacy, you're welcome to call me directly to the office number at 212-CHOICES. 212-CHOICES. So there's a lot of news, cancer news this week, especially we were at the National Radiation Cancer meetings. There's a lot of new information, and there are a lot of interesting patients that I want to talk about, because each of these patients has a story and a lesson, and we learn something from each person. I got a call from a man who then came in. His PSA is the prostatic-specific antigen, so it's this blood test that men get to show whether they have a higher or lower risk of getting prostate cancer. Mm-hmm. It's kind of like a screening test.
Yeah.
Like women get mammograms and women get pap smears, so now men are getting PSAs. And, of course, it's modestly controversial, but it actually is a pretty good screening test because in the old days, most men died of prostate cancer. They weren't aware of it. There wasn't early detection. And usually the cancer was growing, and it would spread to the bones. It would be stage 4. The patient would come in with back pain usually, and we'd do a biopsy and find cancer, and basically that was the end. I mean, the prognosis was terrible in the old days because they had stage 4 disease. It was extensive. There was no early detection. And now most men with prostate cancer are cancer-free, and if they do the right thing, they can even have a high chance of being cured. We don't use that word lightly, but being cured means you live like a normal person, and you die of something else.
Right.
I mean, that's the best thing. You die 25, 30 years later of something else. Hopefully it's making love with your wife or
the finer things in
loved
life,
ones, on New Year's Eve when you're 120 years old. Anyway, so this man came in with a PSA 5, Gleason 7, and of course the surgeon, the urologist is a surgeon, he biopsies the prostate, and usually the surgeons push for surgery. And this man was pushing for surgery, and surgery either with robotics or open surgery. And the patient was questioning me, should he have open or robotic surgery? And I told him, you got to be nuts to have surgery for a Gleason 7. First of all, the success rate in the best hands in America, the best hands. Very famous doctor in Baltimore, success rate is 66%. In New York, 60% cancer-free survival. Our success rate is 90% for Gleason 7 cancer. So Gleason 7 and higher is higher risk, and that's why we tell people they really need custom-tailored treatment. Some people can have no treatment. Some people can have a one-day treatment that takes a half hour. Some people need longer treatment. So everyone needs custom-tailored treatment. And in our hands, a Gleason 7 with brachytherapy and body radiosurgery would give him about a 90% cancer-free survival. That's based on 3,000 men I've treated. So it's not based on moonbeams, but actually many men I've treated, and then we follow the men. Yeah. And also with surgery, most men end up incontinent, which means they leak urine. Most men end up impotent, meaning they're unable to have erections for intercourse. So they've gone through the big operation, which I think most people don't want. Many people have treatment failure. At 10 years with this famous surgeon, the success rate is only 46%, which means the majority of Gleason 7 patients have had recurrence. And they have the quality of life issues. Yeah. And in fact, robotic surgery data, there's a study from Harvard, which I often quote, shows the robotic surgery quality of life is less good than open surgery. So you can have better quality with our program, which is a non-invasive program. Right. There's no operation. There's no radical prostatectomy.
Success rate's
90 versus 60. Yeah. So I urge men, give us a call. Let's talk about it before you get the big knife there.
Right. Certainly kind of find out what you can do for them, Doc. And
so it's a very important issue for every man with prostate cancer. We had several Jehovah's Witnesses. Last week we talked about Jehovah's Witness on the program. Jehovah's Witnesses are people that do not want or will refuse blood transfusion.
Yeah, sure.
And we had one man with cholangiocarcinoma, which is a cancer of the biliary tree, which is the system of the gallbladder and liver. And he was at a big hospital. And this man was going to have surgery. And, of course, as a Jehovah's Witness, he refused, and it was stage 4 cancer. So being stage 4 and refusing blood, refusing surgery, and in terrible pain, he was on narcotics. So I talked a little bit about him last week. He's had his now 3rd treatment after each of the 5 treatments. With radiosurgery is a non-invasive treatment. So we aim at the cancer, try to avoid hitting healthy tissue.
No cutting.
No cutting, no bleeding. You come in, it's 15 minutes. We try to hit the cancer. We've done it on 20,000 patients. We were the first in America to do it.
Yeah, sure.
And pretty much his pain is going away. So it's really rewarding to see this man who was in intractable pain, with the pain going away, good results, and happy that the treatments have been so successful. So, and then I had another person who's Jehovah's Witness, and he heard it on the show that we talk about it and try to respect people who do not want surgery Well, I don't want surgery either if I can. Well, I don't want surgery either if I can. Well, I don't want to avoid surgery.
I don't want anybody. I don't
want cutting, bleeding. I mean, blood transfusions if you can avoid it. Why not? So it's an open invitation. If you want to try to avoid surgery for your cancer, or if you've had prior chemo or radiation, think about all the treatment options out there, and I'd be happy to answer your questions either privately or in person or on the radio. So we're going to go to this commercial break. We have a tremendous sponsor who has the most beautiful voice I've ever heard.
Sounds very familiar, Doctor. And give us a call when we get back. 1-800-848-9222. And we're live.
Thank you very much.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Liederman.